Go. Hello, everybody. It's Carl Rodriguez again from Joining the Dots, the Startups Network. And I'm really pleased today to have Svitlana Surodina from Skein, who is split between the UK and Ukraine on the call today. I've known Svitlana for a number of years now and love what they're doing. A very smart organization. And Svitlana's in where we've got this whole idea of, Joining the Dots, bringing together a load of people who are building like the new digital earth. Svitlana's very much involved with digital and data, AI, and particularly has been doing some really interesting work in healthcare. So welcome, Svitlana. How are you doing today?
Thank you very much, Carl. I'm very well, thank you, and thank you for having me. It's been a pleasure, likewise, to know you and work with you, and to being the part of the wonderful community which is Joining the Dots. I'm looking forward to today's conversation.
Yeah, so let's explore a few things that have been happening in these last. I mean, we're recording this in just about to start June. Towards the end of May in 2020, and obviously we're a few months into the COVID-19 outbreak, and I know you've been doing some great work in healthcare and thinking about how data analysis and data can be leveraged to ultimately improve health and improve how healthcare companies get results and so on. But I know we were talking a little bit in advance around the whole concept of health and wealth, and how things are changing in these times. Do you want to just start off the ball rolling with some of the things that you're observing in terms of trends and areas around data and digital?
Yes, absolutely. So obviously, with the crisis that we've all been going through, the issues of health and how do we protect health? How do we make sure that things like that don't happen again? And the answer lies very close. We all understand that being aware in advance, plan, and focus on preventing health crises on the level of society, but also individually, is the most important thing. And responsibility for preventing those problems and illnesses actually lie not only on individuals, but also companies, businesses, societies, governments. And taking this a bit further, technology really helps us to monitor and improve our health, and in particular, anything related to well-being, anything related to kind of self-monitoring and being able to address some of the issues before they became really complex and really challenging. So obviously, a lot of businesses now, and if we look from sort of business community perspective, are realizing that taking care of their employees' health and being concerned about health-related issues really for them is about being able to survive as a business, to be able to deliver their products and services, have their key employees and all their workforce available for work and healthy and productive. So now this really not even a trend, it's underlying necessity for each business to start thinking hard about those matters. That's what we see really as a main trend, and we're working with a few organizations to help them to understand where they are in kind of this grand scheme of things, how they leverage some of their data access, their processes, the remote work. That's really key right now and will remain important in the foreseeable future. So that's the overall theme.
Yeah, I don't know. Obviously, you can maintain confidentiality, but are there any particular examples that you can talk us through in terms? I'm always fascinated by data and how it can inform things and how it can help. Any sort of practical examples that you might have?
Oh yeah, absolutely. We as a company collaborate with universities on research as well as development of digital solutions around healthcare, in particular health-related data. And now we see how important it is, from one hand side, to be able to share personal data, so we can aggregate it and leverage for insights, like, for example, interaction tracking, or really creating analysis at scale of any particular illnesses or conditions. So sharing data is really important, but also we have the whole array of have problems related with that. So, for example, how do I make sure that my data is secure? No one is trading it. No one is taking advantage of my vulnerability, for example, as someone who may not understand very well what data security is and privacy is. So finding that balance is really important, and we've done quite a bit of research and published a few papers into the space of how do we create ecosystems, technology platforms, but also regulatory environment around protecting data, but also helping companies and individuals to open it up and exchange it more freely. And you mentioned in some of our previous conversations, the blockchain implementation, for example, encryption, so some of the new trends in quantum computing that can help us to handle those problems and address them efficiently with technology.
Yeah, it's fascinating, isn't it? I mean, I'm always curious about this thing about sovereignty. You know, like, I mean, I talk about building the, empowered new digital earth, and I think, sometimes even in the past, you had NHS who had some controversy over their data management for individuals a few years ago, and so because I know, as we talk about, technology can be used for good, it can be used for bad, or it can be used for freedom or suppression potentially. And I'm very aware that we've got these sort of data architectures or infrastructures where more and more data sharing is happening and more data is joining up. And then you've got other people who obviously, from your perspective, you're talking about how to have more control over your data. How do you, is there anything you can talk to about if you think about the control, if we use the word control, how a government might control data and how an individual might control data? And I get your point about balance, but is there anything more that you can open up around that topic? Because obviously individuals or governments or businesses have all got to thrash out that topic and work out what is the balance. Anything you can talk to that?
Yes, of course. So I guess one of the important aspects here is where the actual data is located and how we manage access. There, obviously, the technologies that help decentralization of information, and one of the ways how we can address that is make sure that I, as a patient, as an individual, have my personal data all stored somewhere nicely in my separate server, which ideally is located in my house somewhere, and I don't allow anyone to access it directly. Any analysis or access goes through federated kind of layer of security, where I potentially monitor what pieces of data I give away to each of the company who may request that. So that's kind of one side of the vision of this ideal world. Realistically, of course, this would require an absolute technical capacity of each individual to do that, to install their own server and be absolutely aware about types of data and implications of sharing, and monitor where and what is going outside of the secure storage. Realistically, I don't think it is achievable. And also it limits really action on society on governmental level, and other side of situation here, where we give all the information to government or one company that stores all our information and hopefully this security is good enough for the servers, and we can make sure that kind of they taking care of us, and they taking care of our rights and information. And it's, I guess, as much a political question as anything else. To what degree do we want to take control of ourselves, of our health, or do we want to delegate it to the government, or some international organizations or companies like Facebook or Google? And I guess answer lies somewhere in between, and we need to all work together towards building this ecosystem that would balance the best of both worlds.
Yeah, fascinating, isn't it? Just the timing of all of this, in terms of we are literally all building the future in a digital and a data realm, and yeah, that's really interesting. What would you say? I mean, I know you guys really have amazing skills in AI and data analytics and machine learning and so on. If you thought about, you know, the vision for health and how data and AI can have a positive impact on our lives from a health perspective, what are maybe you know, what's one of your favorite things you like to almost daydream about as one of the things that you think is the untapped potential that you'd love to work on?
Oh yeah, absolutely. Obviously now we have an ability to access such a wide variety of all types of data, from individual medical history to lifestyle to any behavioral patterns, even environment and family history, and really being able to tap into each individual data cloud and find solutions and individual treatments for person as opposite to a group of people. That I think where it gets really, really exciting, because personalization and prevention taken together practically means that I can get an ideal treatment for myself based on my unique situation and unique health and unique individuality. At the same time, use that knowledge for applying it and basically fighting any upcoming issues or conditions or potential risks that I may have in advance, without the need to ever get sick and unhealthy. And at the same time, if we take this wonderful world of knowledge based on human data and aggregate it at the population level, we then will be able to find answers to problems that have been bothering humankind for a long time. How we create vaccines for many untreatable yet illnesses such as COVID that we all know about now, but there are also others like HSV. There's many other conditions and diseases, especially rare diseases, that may affect maybe just a few hundreds people on the earth, but still be very severe and very debilitating. So the opportunities that access to data and ability to process it, that those things give us really opportunities that's hard to imagine something similar to in the past. And interesting part as well to that story is that we as a humankind, we already have the computational capabilities to execute really sophisticated, really high load calculations and modules, analytical modules on top of that. And we have tools and instruments. The only thing that we're missing right now is data. We would efficiently and securely aggregate and analyze. So that's where our next frontier lies, I guess.
And talking about next frontiers, what about quantum computing? Do you see that as offering another level of progress, like another quantum leap forward?
I had very interesting conversations with a few people during last month who work in the space of application of quantum computing capabilities to health challenges, particularly COVID challenges like vaccination, for example. And obviously the technology and the whole infrastructure is quite at early stage. But I think potentially it gives us really amazing capabilities there as well. Obviously, that will lead to the need to restructure the world as we know quite a bit. So, for example, security and passwords and all these things will need to be rethought and adjusted. But definitely, I think it's an interesting direction. The problem is we don't know how fast we can start really deploying it at scale and applying.
Okay, well, it's going to be fascinating carrying on this journey with you. As I say, we've known each other for a few years, and I'm really fascinated to see, I mean, what you mentioned about individual treatments as well, and that's something a whole world is sort of opening my mind about, sort of what that might mean in real terms, and so it's exciting, and maybe we'll do this again at some point and get an update for you, Svitlana. But thanks for today, and we'll post some links to Skein's website in the description below, so people can check out the work that you're already doing. There's a bunch of case studies on the website, and we'll watch this space for more healthcare data innovation.
Thank you so much, Carl. Great speaking with you.
All the best. Take care.
Cool. Okay, my computer is out of charge.